Well, of course, it's a new year, but still we are talking about COVID, but yet it's also flu season, cold season, and maybe if you and a family member start to feel a little ill, a little under the weather, you wonder which direction to go. Let's go ahead, welcome in Dr. John Morrison to the show today to break some things down, give people maybe some information they need this time of year. First off, good morning, Dr. Morrison, how are you?
I'm doing wonderful. Good morning to you as well.
So let's dive right in. You always hear,
Sure.
like, if you're feeling sick, where do you go? I was sharing with you before we got started. I was just renewing my health insurance, and I saw again the importance of the primary care physician. Health insurance companies know how important they are. Should that be your first stop, or why are they always so important to our health?
Sure. A primary care physician is essential to help you and your family stay healthy. I consider primary care physicians sort of like the hub or headquarters. They'll coordinate care. They certainly do a lot of preventative care by catching some of the risk factors early, and they treat chronic conditions, basically resulting in longevity and a better overall quality of life for the patients.
Dr. Morrison, I feel like it wasn't that long ago before urgent care started popping up, and that's become a choice for patients now. And I know the debate we even have in this house. Do you go to the emergency room, or when do you go ahead and go to these urgent cares that really are popping up all over?
Yeah, that's a great question. Kind of to differentiate from emergent care, urgent cares, and even a physician's office, typically the emergency room would be used for emerging conditions such as chest pain, seizures, palpitations, burns, if you suspect a stroke. On the other hand, urgent cares would be better off for non-emergent conditions such as cuts, burns, allergies, cold symptoms, sprains and strains. And now, most primary care physicians are seeing patients via telemedicine, over the phone, and in the office. So, because of COVID and things that are going on, patients have even more access than ever before to physicians. So it's wonderful.
Would you consider some of those other options ones to not necessarily replace if you don't have a primary care physician, but since there are more options than we've seen even before, I mean, even just the telemedicine that you brought up, is that a substitute for the primary care physician, or is that PCP still a definite need?
I just in terms of continuity of care, I have several patients that have tried urgent cares for a year. And when they go to urgent cares, it's wonderful. However, sometimes they'll get a different physician. So it's as far as the PCP, continuity of care is so important. I get to know my patients so well that when they come in, before they say anything, I know something's going on. So I think a PCP as headquarters is the way to go in terms of just someone looking after you.
Well, of course, using the term headquarters shows the importance of that primary care physician. But say people new year, they're like, this is going to be the year that I want to find that primary care physician. What are some tips or guidelines that you have if a person is seeking out that new doctor in their life?
Sure. I mean, it's very important. You want to find a physician when you meet them or when you do the research that has good marks, number one, because there's a lot of rating systems out there. So, do your research. But you want to look for a physician that's kind, and more importantly, one that'll listen to you and not just sort of listen about half of what you're saying, make a diagnosis, and then kind of rush you out of the room. So you want a physician that takes the time to listen. You want a physician that's well-versed, keeping up with the latest and greatest on medicine. Just overall, you want someone who cares.
And that relationship, like you said, they listen, talk, you've got that communication between the two is so important. So I'm glad you shared that today. Well, Dr. Morrison, it was really nice talking with you. Anything else for people to keep in mind during this time of year if they are starting to evaluate and really thinking about getting that primary care physician for them?
Yeah, sure. As far as AdventHealth, we offer a great option called virtual care. And you can access that via the app that you can download on your phone. And via the app, once you establish a primary care physician, you can actually see that physician via telemedicine. And so it makes it very convenient, in the comfort of your own home.
Oh, that is easy. And knowing it's your physician matters so much. Again, findmyphysician.org is right there on the bottom of your screen. Again, thank you for being with us today. Take care and stay well.